Children's Hospital in New Orleans is the largest pediatric hospital in the state, as well as the Gulf South. It also houses the only pediatric stem cell transplant program that's accredited in the state.
Children's Hospital in New Orleans stands up for the entire state and the Gulf region to make sure that children, no matter what's wrong with them or how old they are, that they get the care that they need. I think we're always proud that not only like the breadth of subspecialty care that we provide, but that we also have a lot of sub or advanced care that's provided here.
Louisiana routinely ranks at the bottom when it comes to health disparities. There's a lot of reasons behind that. Part of it is our health outcomes. There's also our environment, the geography of the state, as well as the socioeconomic impacts that drives that.
Most of the patients that come to Children's Hospital of New Orleans from out of the New Orleans metropolitan area have to travel to come here. Our patients might not even have a car. Their financial capabilities might be low. The Medicaid patients that want to access highly specialized care require approval. That might delay their treatment, especially in the setting of an elective transplant.
The health disparities don't only exist in patients that successfully make it to transplant. We have also found that patients who are Black or African American or Hispanic and patients that are from a lower socioeconomic group are not able to make it to transplant at the same rate as others. Our approach to addressing the health disparities that exist within Louisiana and the Gulf South is to look at, one, how can we reduce the complication that disproportionately affect our Black and African American and Hispanic populations, but also to look at how we can improve access to stem cell transplant and cell and gene therapy.
I am very interested in transplant and cellular therapy access in Latin America. These are countries with very large territories, large populations, very wide range of socioeconomic statuses and access. So this is very challenging to be able to offer a transplant.
Louisiana has the most sickle cell patients per capita in the nation. Also, Louisiana, geographically speaking, is disadvantaged in a lot of ways because the places in the state where the most specialized hematology care are not centrally located. So we spend a lot of time thinking about ways to not only care for the sickle cell patients that we have in the city, but to also be responsible for the patients that are cared for around the state.
I think I was a few months old when I was diagnosed with sickle cell disease. Anything could provoke a crisis, such as playing football with my friends or brothers, cousins. Up until the age of 12, 13, I was in hospital every single month. It was difficult. I missed a lot of school. My interest in undergoing a transplant led me to Children's Hospital in New Orleans. I believe that this treatment will allow me to pursue a career in aviation and do many things that was once impossible.
Jordan was diagnosed with aplastic anemia in 2024. We are originally from Jackson, Mississippi, so that's where she was diagnosed. The level of care there was good until she acquired the infection. So with that infection, it required multiple surgeries. And after so many surgeries, it was just at the point where they couldn't provide the care that she needed to get to transplant. And Dr. Pareda took Jordan on as a patient, and we came here to New Orleans within a week, and within 2 weeks she was receiving the care that she needed, and within a month she received her transplant.
The research we're doing at Children's Hospital of New Orleans is directly related to reducing the impact of having a mismatched donor and how we can make transplants safer for all patients, specifically Black and African American and Hispanic patients. The research we're doing is using a drug called abatacept to prevent graft versus host disease. And we found that this drug can help reduce the racial disparities that come with a stem cell transplant.
Here at Children's in New Orleans, we're always working on understanding at a patient level what are the specific barriers that prevent them from doing things. Researching that to understand if there are certain populations or certain features that people have that make them more at risk for complications or more likely not to get the best care. That's a really delicate and maybe even in some ways new way to think about how to care for patients. A lot of it right now is asking questions and understanding trends, and we hope that that turns into more nuanced ways to deliver care and that we're able to reach more people.
The city of New Orleans is a city of hope and joy. Its culture is like none other. The food, the colors, the music. But underneath that, there's a lot of suffering. There's a lot of despair. It's not unlike what a stem cell transplant is. There's a rebirth that needs to take place, much like this city has had to rise from the ashes on several occasions. I want to be a part of that rising from the ashes and standing in the gap for kids who have no other alternatives, helping provide hope for diseases that are often hopeless, and helping to change the health of a generation.